Imagine healing the heart from within. Imagine the difference between struggling for every breath, struggling to exercise, struggling to walk, or having your heart function back. I'm Thomas Smink, the President and CEO of Hemostemix. Our research explores and defines how a simple idea supporting the heart by improving its blood flow improves your quality of life. Heart disease steals energy. It steals your confidence. It reduces your quality of life. And for many people, the medications they are on and the procedures that they go through only go so far. The reality of heart patients is that many patients live with chest pain, chronic angina. Many are breathless, have fatigue, and find themselves with only the ability to sit on the couch or sit in a chair. There is reduced mobility, and there is obviously diminished heart function. And many eventually reach a point where procedure options are limited or no longer feasible. They become no-option heart patients. What our published research shows across 4 studies of heart disease, 208 patients studied, is the following. Improved ejection fraction, meaning improved volume of blood ejected into the circulatory system with each heartbeat. Fewer or less chest pain. Angina patients went from chest pain at rest to no chest pain at rest, only experiencing chest pain during exercise. We demonstrated a statistically significant reduction in perfusion defects. We saw a 27% increase in exercise capacity as measured by the 6-minute walk test. And we saw improved functional capacity and improved quality of life. These findings encourage the continued study of ACP-01 for cardiac indications such as angina, ischemic cardiomyopathy, non-ischemic dilated cardiomyopathy. And I encourage you to join a clinical trial at Hemostemix where you are guaranteed to be treated with ACP. How ACP works is as follows. Imagine taking 250 cc's of blood from your arm, fractionating out your stem cells, educating those stem cells so that they create new circulation where the heart signals it needs new circulation. And a week following the donation of blood to yourself, you're in a procedure with your cardiologist who injects the stem cells into the collateral arteries of the heart. How ACP works for patients is that these cells are your DNA. They are smart, they're educated, they have a built-in GPS. They use that intelligence to home to the site of need, engraft in the areas of the heart that need new circulation, and neovascularize it, and recruit stem cells that are circulating in the blood to the heart to aid in its regeneration. This regeneration is measured by the volume of blood ejected with each heartbeat. And our studies demonstrate up to a 27% increase in the left ventricle ejection fraction of those patients who had the most severe form of heart disease with ejection fractions down to 20% or less. Hemostemix is completing a clinical trial of heart disease. This is a phase 1 trial to demonstrate that ACP works at the beginning stages of heart disease just as well as it has worked at the end stage. All of our studies to date were based on no-option patients treated at the end stage of heart disease. This opportunity is to join a clinical trial and be treated for ischemic cardiomyopathy at the earlier stage. We believe that we will show ACP works just as well at the beginning stage as it does at the end stage. Obviously, if it works at the beginning and it works at the end, it will work throughout the continuum of heart disease. So I encourage you to join our clinical trial. We don't replace your heart. We are studying how to support it from within using your own stem cells. If you're ready to explore what this could mean for you and for your life, click below to book a call.